So with prolotherapy and PRP, the goal is that we're stimulating the immune system to heal itself. Prolotherapy uses a solution that we make in the clinic with a hypertonic dextrose. The thing that's different with PRP or platelet-rich plasma therapy is that we're using the patient's own blood. So here we're drawing the blood specimen, and we're going to draw about 60 milliliters of blood, and you can see that in Mindy's hand here. And we're going to insert that blood into a proprietary piece of equipment, and we're going to inject that blood down into that tube, and you can see it filling up. Here we're putting this container into the centrifuge, and it's going to do all of the work for us, and it's going to separate the red blood cells, which is the majority of the blood, from the plasma and a thin layer of platelet-rich plasma, which you'll see here in just a second. So we're spinning this stuff to get it processed. We'll advance ahead, and we're opening the lid of this thing. And this has the separated solution. You see the yellow stuff there is the serum. Mindy's already removed the serum, and the only thing left on the left-hand side of that container that she's mixing up is the platelet-rich plasma. So there's all of the platelets and the growth factors are going to be in that area. Now here I'm taking our patient, and I'm actually just palpating in the same way I would with prolotherapy, palpating the area that needs to be injected, and for him it's the bicipital tendon for his shoulder, as well as the insertion of the pec major, or the chest muscle, on the humerus. And so here I'm just identifying those tender spots and marking those areas, which is very important for prolotherapy and PRP, to make sure that we get those right areas. So thorough is the name of the game. Here we're getting ready to get started. I've already got the areas cleaned up and the tender spots identified, and we're going to begin the injection procedure. And we're just starting to inject those tender points. And I'm just injecting the area with the platelet-rich plasma therapy, and you can see the solution there, just injecting a small amount in each area. And this is what we've gotten from the serum that we've drawn off and processed, is about 4 milliliters of the platelet solution, and we're going to use all 4 milliliters for the anterior edge of his shoulder in the exact same way that we would for prolotherapy. The only difference between prolotherapy and PRP is the solution that we're actually using, and PRP seems to be a little bit more robust in its response, and patients tend to get a little bit more sore after the procedure as well. And so here we're just making sure that we kind of fan out that solution all along these tender areas. We just want to make sure that we're real thorough to get good coverage of that entire area. Just continuing to inject all of those, and it's again, with prolotherapy and PRP, we want to be very thorough, and that's the key with Hackett-Hemwall prolotherapy, is the thoroughness. It's not a single injection. It's not one area only. It's very important. So here we're just reassessing, and we're having the patient move around. We've added a little bit of lidocaine into the solution to make sure that we get the right areas, and he should be essentially numbed up. And generally the feedback that we're looking for is, yeah, you got all the right areas. Now here on our reevaluation, we've determined that he's still got an area of tenderness, and so we've targeted that specific area, and then we're going to retest again to make sure that we've been very thorough and gotten all of those areas that we need to get. And after we get that area, again, we're going to reassess. Now we're going to check again and have him move around and check that area. Have him move it, and we're looking to make sure that that pain has been appropriately addressed.